Hello and welcome to our lecture about antivirals. I'm going to talk about antiviral drugs that are used to treat influenza, herpes, and Hep C. Here's our outline. We're going to talk about three different types of viruses, or three types of families of viruses. That's going to be the herpes family, the influenza family, and then the hepatitis C. There are three virulence factors that we're going to go over for the influenza virus. The first one being hemagglutinin. Hemagglutinin works by binding onto the sialic acid on our membrane. So you could see the virus over here being introduced to our cells. It has hemagglutinin all over the outside that binds onto the sialic acid somewhere around here, and this introduces the virus into our cell. So the hemagglutinin helps it get in. The next one that we need to know about is going to be the M2 protein. This M2 protein will decrease the pH, and this changes the protein coat and allows the RNA to be released into the cell. This RNA will replicate and make several different viruses that will then go and start budding off over here. But the issue is that these budding viruses can't really be released and spread unless they detach from the sialic acid that's on our cell surface membrane. So what happens is it gets an activation of neuraminidase. This neuraminidase will break down the sialic acid. That's why it's also known as sialidase, but most people call it neuraminidase. And this allows the prodigy viruses to be released by cleaving the sialic acid that they remained attached to. We're going to talk about a few different drugs that target these virulence factors, like Amantadine and Oseltamivir, or Tamiflu, that is. Let's talk about Amantadine and Rimantadine. Both of them work the same way. They inhibit the M2 protein, and if you inhibit the M2 protein, what happens is that the virus can no longer acidify the area around it, and so it can no longer uncoat. If you can't uncoat, you can't release your DNA, so you don't get the release of the DNA or the fusion or the replication of the progeny. So right now it's pretty much absolutely useless. There's pretty much a 100% resistance in the United States. That's why you never really hear about anybody taking amantadine for a flu. But however, we did find out that amantadine also blocks the NMDA receptor, and you'll learn in neuro that that can be useful for Parkinson's. We don't really know how that helps or why, but it does help some people with Parkinson's disease. Let's talk about Oseltamivir or Zanamivir. So they both work exactly the same way. You've probably heard of the brand name Tamiflu. If you've ever got a flu and you take Tamiflu, you could probably nip it in the bud before it gets any worse. They work by inhibiting the neuraminidase inhibitor. And this neuraminidase inhibitor prevents the virus from spreading. It prevents the breakdown of sialic acid. So while the new progeny viruses will just start budding, they get prevented from being released and continuing the infection. So you can stop the flu early if you catch it early. So the idea is that you have to treat influenza A or influenza B within the first 48 hours. Before the first 48 hours, because before then the virus has not started budding very much and it has not spread into your entire body. After that, there's no real use because your body's going to fight it off anyways. We often recommend using Tamiflu for at-risk patients, people who can possibly die from a flu, such as elderly with dirty grandchildren that are always carrying the flu. Let's talk about the herpes family. The herpes family is special because they are a class of DNA viruses. They are enveloped DNA virus, and they like to remain latent within the nucleus. So that makes them quite different. They almost fuse pretty much with our DNA, and they come in at random times. So the treatability of the herpes virus varies by each group. We have the HSV 1 and 2 and the varicella zoster virus. They have these enzymes called thymidine kinase enzymes, and this activates the Acyclovir drugs. We need this enzyme to be inside of the virus. It's specific for this virus in order for these drugs to work. So a cell that is not infected with these viruses will not see the effects of these drugs take place. Another one that's a little bit harder to trade is going to be CMV. CMV has a different one, which is called viral kinase. And this one requires different drugs because it doesn't use the same thymidine kinase enzyme. We need a different drug in order to see the same effect. Here's a little bit of a review over each of these viruses do. HSV1 is known for cold sores. It's just weird cold sores you get oftentimes during the winter, and it can also cause gingivostoma in children, where when they first get their HIV infection, it causes a lot of bleeding in the gums. It can also come back and it'll be presented in the neuromodule as a temporal lobe encephalopathy. It can spread into your brain and cause a lot of bleeding there. HSV2 is known as genital herpes. This is a recurrent painful sores around your genital area, and it can also affect neonatally if a baby is born to a mother who has genital herpes. Moving on to HHV3, that's varicella zoster virus. It's known as varicella, for i.e. chickenpox, the chickenpox disease, and then the zoster, which is just another way to say shingles disease. HHV4 or Epstein-Barr virus is also known as mono or monoinfectious nucleosis. It can also cause other diseases such as Burkitt's lymphoma and nasopharyngeal cancer. Let's talk about the cyclovir family. This family includes acyclovir, famciclovir, and valacyclovir. They all work pretty much the same. They're all guanosine analogs, and they work by first being activated by the thymidine kinase. It's important for you to know that if they get into an uninfected cell, it doesn't cause anything. They don't get activated, so they don't really work. They only really work in activated cells because the virus has to express this thymidine kinase enzyme. Once the virus activates it by adding the first phosphate group, what happens is our body then can continue adding the phosphate groups, and then it can mimic some sort of nucleotide like guanosine. So just after it's mimicked this guanosine, what happens is it gets incorporated into the viral DNA, and when it gets incorporated into the viral DNA, it can cause chain termination. So as you can see, I've shown you a picture over here of guanosine. Guanosine has this base over here and a ribose sugar, while acyclovir may have a similar base right there, but it does not have a ribose sugar and is missing the 3' hydroxyl group. So what happens is that when this is incorporated into the DNA, you have a chain termination below it. It can be used for HSV and VSV, only really in active infections. It doesn't really work in the latent infections because these are not replicating. You can also have different variations of acyclovir. Valacyclovir, for example, is a combination of acyclovir. You've got acyclovir right here, and valine, which is just an amino acid. And what this does is it gives it good bioavailability. That means that you can take it orally pretty well. And once it gets into our body metabolizes it and gets rid of the valine, and then you've just got acyclovir floating around. Famciclovir is used for the only group of herpes that you can get spread from your family. I'm talking about shingles here. Now, when we're talking about shingles, it's pretty much the same thing as zoster. Zoster being the virus, of course. So famciclovir, I like to think of it as being predominantly used for the shingles virus. What you need to know is that it has no effect on the CMV because CMV does not have thymidine kinase. In actuality, a way that a herpes virus can develop resistance to these drugs is that it has a mutation in this thymidine kinase. The adverse effects are pretty minimal for these drugs because, as I mentioned before, they really only need to be activated in infected cells. If they go into a non-infected cells, they won't be activated. So you have a decreased risk of these being incorporated into our DNA. They only incorporated into the DNA of the viruses because the viruses are obviously going to be replicating a lot more. Now, the big side effect over here is going to be obstructive crystalline nephropathy. It's because when they build up in our blood too much, they can kind of crystallize, and they can crystallize into the kidney, and this can cause an obstruction and cause a lot of damage. So it's very important that patients taking these drugs, especially if they're taking it IV, you have to keep them hydrated. As long as you keep them hydrated, you'll prevent these drugs from crystallizing and causing kidney damage. Let's talk about Ganciclovir. It's very similar to the cyclovir family, and it also ends in cyclovir because it is also a guanosine analog. and it works in almost an identical way. The only difference being that instead of being activated by a thymidine kinase, it is activated by CMV viral kinase. What that means is that it can be used to attack cytomegalovirus, which is the herpes virus number 5, HHV5. So what it does is it works the exact same mechanism. It gets incorporated into the viral DNA, but it can also be incorporated into the human DNA as well. And this is because the cytomegalovirus tends to infect a lot of white blood cells. It can cause a lot of immunosuppression or bone suppression that we're going to talk about in a little bit. Unlike the other herpes viruses, which tend to infect neurons. And since neurons don't really replicate, we don't really get a lot of suppression there. But it works exactly the same way, and it is still a guanosine analog. If this is guanosine right here with its base right there, it is a guanosine analog, and it causes a chain termination because for this over here does not really work as well as this as a building block. So what do we use it for? It's going to be used for, of course, the CMV infections. It also has another variant, just like the Acyclovir. It has Ganciclovir, which you can probably guess by now that it is a prodrug that has a valine on the end of it. And it's also has a similar effect as Valacyclovir in that it has very good oral bioavailability. So you can give this to patients as an outpatient treatment. The bad effects of it is going to be that it causes bone marrow suppression. So you got to think of while HSV1 and HSV2 and 3, they all tend to infect the neurons more than anything else. This virus likes to infect T cells and macrophages. So what does that mean is that this drug is going to be activated in T cells and macrophages. And we can't really determine if it's going to be incorporated into the viral DNA or our own DNA. But whenever it is incorporated into our own DNA, it can inhibit our DNA from replicating. And that can be pretty bad because that means that your T cells and your macrophages won't be able to reproduce and build enough to fight off infections, and you can get a lot of bone marrow suppression. I showed you a picture over here of a dry tap or a bone marrow dry tap, and you can see it's just a whole lot of fat inside of the bone marrow, not as many cells that you would expect to be filling up your bone marrow. Another thing that you need to know is going to be renal toxicity. Something that most people don't realize is that CMV has a tendency to also infect epithelial cells, and these epithelial cells inside of the tubules of your kidney can also be prevented from replication. So while your kidney needs to regenerate these tubules, it can no longer do that if you're taking Ganciclovir, and this can cause renal toxicity. Cidofovir is a bit different in that it's not a guanosine analog, it's more of a cytosine analog. And I remember that as Cido, which means cytosine, and FO, which just reminds me that it is already phosphorylated. So you don't really need a kinase of any kind to use it. And then it ends with a vir at the end, so I know it's an antiviral drug. And here it is. Here's cytosine. You've got that base right there. You've got the ribose sugar, and you've got the phosphate. Over here, you've got Cidofovir. It looks very similar. It's got the base and it's got the phosphate, but it doesn't really have the ribose sugar. Now, what it's used for is it's saved for pretty much the more resistant CMV and HSV. The ones that don't really have a thymidine, you want to give them something that is already pre-phosphorylated, so it's already pre-activated. The adverse effects is going to be very similar to this other cyclovir family in that it causes nephrotoxicity. It's nephrotoxicity because it gets excreted by the kidneys and it can crystallize just like anything else. And the treatment is still the same. Make sure that they are hydrated, or you can develop something like acute tubular necrosis, where you just get killing of all of these cells from all the crystals building up and damaging all the tubules. Some important drug interaction that you need to know about is that probenecid inhibits the excretion of Cidofovir. So if you're taking probenecid, which is a gout drug, what that means is that Cidofovir will stay inside of your system, inside of your blood, rather than going into the tubules of your kidneys. And this is good for reducing nephrotoxicity. You can give a lower dose of Cidofovir, it'll stay in your blood, and not very many will get into your kidneys and cause crystallization and damage. So Foscarnet is just a play on the word phosphocarbonate because that's exactly what it is. It has a phosphate group and a carbonate group, and this phosphate group can wreak havoc for a lot of the viruses. It tricks them by binding onto the phosphate binding sites of all the viral enzymes. Any virus, any phosphate binding site of any virus, and that'll actually inhibit enzymes like DNA polymerase, RNA polymerase, and reverse transcriptase of any virus in your system. And this does not require any kinase, so you don't really need a kinase like the other one because it's already pre-activated. It just goes and it binds directly onto the enzymes. It's used for very resistant CMV and HSV. Something you do need to know is that it can cause chelation of gram-positive. So you could see over here, this thing can be negatively charged, and this over here is also negatively charged. And what it can do is it can chelate a lot of the positively charged elements like calcium. So if it chelates the calcium, it can bring it down and it can cause hypocalcemia. You get a decrease in calcium in your blood, and this will cause a lot of stones and toxicity inside of your nephrons, and that's going to cause nephrotoxicity. Something else that it can chelate is going to be magnesium, which is also positively charged, and a low magnesium causes an increase in seizures. That's because you're lowering your seizure threshold. Magnesium is usually there to calm your heart and calm your brain. When it gets chelated out of your body, you're at higher risk of seizures. Another thing that it can do is it can chelate the potassium, and what that can cause is hypokalemia. Let's talk about hepatitis C. Hepatitis C is an RNA virus, more specifically a flavivirus, and that makes it a little bit different from the herpes viruses. What it means is that it can use our ribosomes to make polypeptide precursors. So the first couple of steps, entry and uncoding and whatever, is pretty much the same. But when it starts to change is that it can make a polypeptide precursor. So it makes these little polypeptides. And after you make these polypeptides, you have these proteases, which can cut up these polypeptides into little smaller segments that are used for the coding. So over here we've got a protease, and we can use some antibiotics like Simeprevir to target these proteases. Another thing that you need to know is that it makes its own RNA in the cytoplasm. That's because most RNA viruses, unless it's a reverse transcriptase, will replicate within the cytoplasm. They don't really get into the nucleus like the herpes virus do. So what that means is that they don't really have access to our RNA polymerase. So they have to use their own over here to replicate their RNA. And that just means that because they use their own, it's a little bit different. We can use a drug to inhibit theirs without necessarily inhibiting ours too much. Something that you need to know is that whenever a cell is infected by this virus, more like the hepatocytes are infected by this virus, they release an interferon alpha. And this interferon alpha triggers an immune system response to fight these cells. It tells the cells, hey, I'm infected. Please come over here and help me just clean up, kill the cells that are infected. And it also warns the adjacent cells so that they don't become prone to infection. They can kind of start defending themselves early. So just something to note that the treatment for hepatitis C is still fairly new, and it changes a lot from year to year. So depending on which year you take step one, the drugs of choice for hepatitis C may vary. Let's talk about interferon alpha. Interferon alpha works by triggering an immune response against infected cells. And it works by, first you trigger the response by increasing the expression of certain protein. So what it's going to do is going to go to the DNA and it's going to cause an expression of certain protein. And these protein can inhibit the hepatitis C virus replication complexes like RNA. They can pretty much destroy it before it gets bad. What else it can do is it can release a whole lot of inflammatory markers and a lot of signals for our immune system to let it know that this cell is infected, and our immune system can then go and kill the cell before it starts infecting the rest of your body. This interferon alpha is often used for hepatitis C, but it can also use for hepatitis B virus, Kaposi sarcoma, which is just HHV8, condyloma accumulatus, which is HPV. Some other ways that you could use it is for some more cancerous etiologies, because also cancers can also benefit from an immune response. This is more specific for hairy cell leukemia, renal cell carcinoma, and malignant melanoma. This is just because these these cancers don't tend to respond well to chemotherapy, so our only way to really fight them is our immune system. So we give them interferon alpha, hoping that our immune system can fight off this battle and take care of them before it gets any worse. The major adverse effects of interferon alpha is, of course, fever and malaise. You would expect an activation of our immune system to cause fever and just the achy feelings that you get when you have a flu in general. Let's talk about Simeprevir. Simeprevir works by inhibiting hepatitis C's protease, and that means that the hepatitis C will not be able to have a coat. As if you can remember, the hepatitis C makes this polypeptide at the beginning, which needs to be cut into little segments by a protease. After it's been cut by a protease, it has these little tiny segments that can be used for a viral coat. But Simeprevir, what it does is it makes this protease completely useless by inhibiting it, and it prevents the virus from maturing and building its coat, which prevents it from further replication. It's easy for me to remember because it has the PR in its name, which reminds me that it's a protease inhibitor, and the VIR, which reminds me it's an antiviral. So I remember it as an antiviral that inhibits protease. It's used for chronic hepatitis C virus. Oftentimes we add another drug called Cidofovir. Cidofovir, you don't really need to know the mechanism as of now, but it's becoming much more common in that it inhibits this protein called NS5A. And this NS5A prevents replication of the virus. And when you use them both together, it has a really good effect in inhibiting the hepatitis C virus, almost to the point that we've pretty much found a cure for hepatitis C. The adverse effects for Simeprevir is going to be photosensitivity and a rash. Let's talk about Ribavirin. Ribavirin is a guanine analog, and by guanine analog, I want to emphasize that it is not a guanosine analog. A guanosine analog has an S, so you would expect S for sugar, so it does have a ribose sugar, but guanine would not have a ribose sugar. So guanosine analog like Acyclovir would be incorporated into the DNA and prevent DNA elongation, while guanine would work earlier on in the chain with the actual nucleotide formation by inhibiting IMP dehydrogenase. IMP, I think of it as the prototype purine molecule. IMP dehydrogenase turns IMP into GMP, which is guanine monophosphate, and that can be used in both DNA and RNA. But since we're talking about the hepatitis C virus, which is an RNA virus, we're going to talk about RNA replication. And if you can't make GMP, you cannot make RNA, so you prevent the RNA replication in the virus. It can be used for hepatitis C virus or for other RNA viruses like the RSV virus. RSV virus is not often seen in adults and is not often really dangerous in adults, but it is dangerous in children. Ribavirin is not really used in children because it's actually really bad for them. What ribavirin can do is cause hemolytic anemia, and it can often be teratogenic, so you don't want to give it to pregnant women or kids that are too young. So with a lot of the kids, what we may consider giving them is palivizumab, which is a monoclonal antibody, instead of ribavirin. Alright, let's talk about Sofosbuvir. Sofosbuvir, I try to remember that the So is trying to hint that it's a cytosine, and the Phos is trying to hint that there is a phosphorase group in there. And that just reminds me that it is a phosphorylated cytosine analog, just very similar to Cidofovir. Over here I've got a picture of a cytosine. You've got this nucleotide base, and this also has this nucleotide base, but instead of the 5' hydroxyl group, it's going to have this large weird group over here, and it's got the phosphate over here. And it tricks the cell, it gets incorporated into the RNA, and it causes chain termination, just like what we've talked about before. So what that means is that the hepatitis C virus cannot make its RNA and it cannot replicate. It is really only used for the hepatitis C virus. That's really the only context, and it doesn't have any really important adverse effects. They're all very vague, like fatigue, headache, and nausea and vomiting, so you don't really need to memorize them. So how do you use this information? I would again focus mostly on the mechanism. It's definitely the most heavily tested when it comes to the antivirals, because if you know the mechanism, it also proves that you have a solid understanding of how the virus's life cycle works. As for the adverse effects, I gave you two hints here. What you want to do is you want to group them up because a lot of them will have similar side effects. Like for example, a lot of the guanine and cytosine analogs will cause kidney problems. And the way that I remember that is by remembering how they cause kidney problems. I try to remind myself that these are all purine analogs, and other purines can cause a uric acid buildup, which can also crystallize in the kidneys. So why wouldn't they also crystallize in the kidneys when the patient is dehydrated? So that's how I try to use the why to it. Other stuff that you could use to try to determine uh, where they play a role is their names. If they have a faux in their name, I already know that they're already pre-phosphorylated, so they don't need to be activated. If they have a Acyclovir in their name, I already know that they're guanosine analog. And if they have a Cido in their name, it kind of sounds like a cytosine. All right. So let's move on and let's say that you're a third-year medical student. You notice that one of your patients is being treated for a resistant CMV retinitis. Okay? So this cytomegalovirus, and he begins seizing. What would you expect the lab values to be? So of course, your treatment of resistant CMV is limited to just two drugs. That's going to be Cidofovir and Foscarnet. But only Foscarnet would cause seizures. If you can just try to remember, what did I told you about Foscarnet? It inhibits or it chelates the calcium, the magnesium, and the potassium. And when you chelate the magnesium, that causes a lot of seizures. But something else that you need to know and you'll learn as you go through medical school is that hypocalcemia can cause a lot of tetani, hypokalemia can cause a lot of arrhythmia in your heart, and then hypomagnesemia can cause a lot of seizures. All right, that's it for antivirals, and good luck studying.